everybody. I have Bonnie here. She is the area director for Apex, who distributes Mavix, which is that box, which contains exosomes. So Bonnie, tell us a little bit about exosomes, because we haven't offered it at this practice. We just did a test on a couple patients, and what can you tell us about exosomes and hair loss?
So exosomes are actually a derivative of a stem cell, but they're not a stem cell. So they're microvesicles, very small, and they are communicators. So they communicate with cells that rejuvenate, restore, and they are going to activate the dormant and active hair follicles.
Great. So that helps a lot, especially if somebody has had hair loss for a while and maybe in the crown, just like we just did. We're going to see if that does activate any growth in his crown. Are you feeling anything?
Yeah, just the pricks.
But you're not feeling any burning?
No. It's exactly what Matt reported.
Yeah, it goes in really smoothly. Just put in tiny little aliquots.
Occasionally you hit an area where there's a nerve and I can feel
Sure.
it more, but
Yep.
So this is a 1 cc syringe, and she's just
27 gauge
with a 27 gauge needle, which is teeny weeny. These exosomes that we're talking about, they come in different concentrations. We just did the 100 billion?
Correct. Yes.
Okay.
And they also come in 40 and 200. So if you think about that, it's the concentration that's actually in the vial. So of course, if you're forcing more exosomes into one vial, you're going to have a stronger result.
Okay, so we just did the 100 billion, and we're going to see how that works out on our patients. And then they have 40, 100, and 200 billion.
Correct.
Okay, those are the options. What is the difference between stem cells from umbilical cords versus exosomes?
So a stem cell, I know that there has been some concern with adverse events happening when people have stem cells injected, because it can cause inflammation. It can sometimes cause, cells to proliferate in a way that they're not supposed to. There's not as much control there. Whereas exosomes are not a cell, they're acellular. So their job is to restore, repair. They act more like a messenger to go in and restore and repair those cells rather than creating a new cell.
Okay, that's helpful. I also wanted to go into detail about the fact that this is an off-label use, and that's why we are testing it on 2 patients who are actually friends of the practice. So Bonnie, can you extrapolate a little bit upon that?
Yeah, so this is a tissue product that was FDA approved for tissue and wound care within the body, and tissue products are approved in a little bit different manner. It's through the lab. The lab itself has to go through a pretty rigorous process of being approved for tissue products. Mavix itself goes through a very rigorous screening as far as where their sources of the exosomes come from. These exosomes are placental derived, so they are from a healthy, delivered full-term placental donor, and then it goes to the lab. The lab processes it and manufactures it, and it's screened and filtered. It goes through a very rigorous process after it's manufactured.
So that's why we're testing it on some friends of the family here, and then when we feel like we are comfortable with it, we will then offer it to all our patients.
Correct, and that would be obviously patient to patient, making sure that it's done in a prescriptive way.
You're almost done with one, Bill.
okay,
That's a lot of little pokes.
Yeah, not bad.
I'm just going to come a little bit on the outside of the area, okay?
That's fine.
No pain? Still no pain?
No, same.
Okay. Well, that's easy.
Okay, so that was 1 cc.
Okay.
And that is, what is the difference between placental exosomes and your own exosomes?
Okay, so your own exosomes, your own stem cells and cells are only as good as you are. So, you think about aging, those things are breaking down in our body. And placental exosomes are from a very brand new source, and everything going on inside the placenta, growing a baby, and everything that is getting restored and created in there. It's like this hub of of new growth, and so those are the kinds of cells, or the kind of exosomes that you're going to be putting in is brand new, amino-privileged.
That's what I want. I want the baby cells.
Yes, we want the brand new.
So everybody's going to stay tuned. I will post photos of Bill and his crown as it grows in. I think I'm going to also look at it under a densometer as well. So we're going to check that out. And then so everybody stay tuned to our Instagram. It might be a reel, it might be a story, but I'm going to keep you guys posted, and we'll see how this works before we offer it to everyone. Thank you so much, Bonnie.
Thank you.